Hello everyone, and welcome to this audio podcast. This audio podcast is part of the Haemotoxy. This audio podcast is part of the Bostics and Baraga. This audio podcast as part of the specials. This audio podcast is part of the Expressing Caliber, and this audio podcast as part of the specials. This audio podcast as part of a Storm the Bostics production. So through this works by M. Hussain, a science student in an academic institution. From science student M. Hussain from an academic institution in the UK. Um, the the this this audio podcast will go into some elements or bases in around a discussion as part of where M. Hussain had informed of had informed of in around the diagnoses of a patient case with suspect for M. tuberculosis through a lobectomy specimen that had been taken. So in as part of the discussion, then, so the objective of this was where M. Hussain had iterated, articulated in on where the basis was to identify if and whether or not a patient case had the tuberculosis had been diagnosed that had been suspect for M. tuberculosis. The H&E, hemotoxin and eosin stain of a patient's pulmonary lobectomy specimen displayed clear signs of infection and characterized by the presentation of granulomatosis inflammation. Hussain informs on where granulomatosis inflammation appears after cell injury and is induced by infection, autoimmune disease, allergy, and neoplasia. Granulomatosis inflammation is characterized by the formation of granulomas, which are composed of several changes in tissue morphology. Granulomas additionally can be identified by the accumulation of clustered immune cells, such as macrophages, which form sort of regions surrounding white cells or lymphocytes that form leukocytic leukocytic cuffs. And due to the close proximity of particular immune components, such as immune components to the proximity of immune components, these aggregate and develop an epithelioid appearance, and labeled where investigators or laboratory investigators would label these as epithelioid cells. Epithelioid cells are consisting of macrophages and lymphocytes or white cells and fibroblasts fuse into each other to actually create indistinct boundaries, and these sort of merged cells undergo nuclear division without undertaking cytokinesis, thus forming a nucleated Langhans type giant cells. Moreover, giant cells can be distinguished or established by their sort of horseshoe depiction, arranged nuclei exhibited at the periphery of each cell. At the same time, the diagnosis, part of the diagnosis, a clinician may decide to offer corticosteroid treatment or therapy as anti-inflammatory treatment to address the accumulation of inflammatory cells, assuming that the patient case is assuming that the patient case in on this where Hussain articulates, it displays progressive lung dysfunction. Visualization of granulomatosis inflammation alone cannot provide a specific diagnosis. Rather, it is characterized. Rather that it is used to characterize histological basis of disease. It should also be noted that granulomatosis tissue can be differentiated into non-necrotizing granulomas and necrotizing granulomas. Non-necrotizing granulomas are most commonly associated with sarcoidosis, an autoimmune condition that is caused by excess inflammation. Necrotizing granulomatosis are also indicative of infection and are distinguished by the presence of necrosis or cell death, and by investigating the tissue reaction, the type of granulomatosis tissue can then be differentiated to determine determine sort of the specific or the specific sort of basis of diagnoses on as this patient case, as Hussain where Hussain had informed on. Additionally, just to inform also, necrotizing granulomas presentation does not diagnose in its entirety a causative agent of infection. Hence, further investigations tend to be required. Selective staining of acid-fast tuberculosis thus highlights it as a cause of infection, whilst ruling out non-acid-fast bacteria such as, for example, Yersinia and Aspergillus, for example. So that draws this audio podcast to a close. This audio podcast as part of the Haemotoxy. This audio podcast as part of the Bostics and Baraga and the specials. This audio podcast as part of the Express in Canberra. This audio podcast as part of a Storm Robotics production.